Hi, I'm Dr. Leonetti. I'm here with Dr. Daniel Stickler, who is the founder and chief medical officer of Appear Zoe. We have two of his products that I carry in the office, and I'm a real big advocate of, and I want to go over them with you guys. One's going to be one we get a lot of questions on. It's the Nutrigenomic Lean, and then the other one is going to be the BP-157. Let's just Dr. Stickler, you want to tell us a little bit about yourself and possibly why you formulated these two products?
Yeah, my background, I actually have a long history of weight loss. I was a bariatric surgeon for 10 years, did over 3,000 weight loss operations. Also ran a bariatric clinic, who evaluated over 10,000 people for weight loss. And I walked away from the surgery because even that just didn't work. And the products that were on the market were just not very effective. But I started doing human optimization work, really just focusing on, how do we make the system more robust so that we're not having to treat diseases? We just don't get them. We make it so that the system can't get them. And that's been the course of my practice for the last 15 years. And, we've gone through several iterations of things. The one thing we find is lifestyle is the absolute essential piece. Probably 80% of your goals are achieved through lifestyle, and the other 20% through medications, supplements, those kind of things. I developed the Nutrigenomic Lean because really, most of the stuff on the market, supplements on the market just tend not to work very well unless they have something illegal in them. And it was just very frustrating because of the marketing machine that would market these things that would help you with weight loss and all of that. So I started doing a great deal of research. I'd actually been doing the research over the years, and finally found a company that could formulate for me. And I put together my wish list and started looking at how everything interacts with each other and how we could use it. And that's how we came up with this formulation. One of the really cool aspects of it is it's got TTA in it, tetrathiodetsyl acetic acid, I think is what it is. I get it wrong every time. But that was one that we could get through compounding pharmacies for a while, and then the government shut that down. But it was also available through supplementation, and it's got some really cool characteristics to it. It increases mitochondrial function and how efficiently cells use glucose. We've also found that it's a great appetite suppressant when we were using it as a prescription. And we're essentially using the same dose in this one as we were prescribing before. But then we have all these synergistic ingredients that work with that, like dihydroberberine. A lot of people have heard of berberine and take berberine with good results for lowering blood sugars. And it's kind of like metformin. Metformin's used in longevity to lower blood sugars and extend lifespan and health span. That study's still underway, by the way, but berberine was a nice natural option for people. Yeah, so the dihydroberberine, the cool thing about it is it's 5 times more bioavailable or absorbable than berberine, because berberine, when you take it, it has to go into the gut. Bacteria have to convert it into dihydroberberine to get it absorbed. So we're bypassing that rate limiting step with those. The other one is a brand new one called L-Beba. I think it's trademarked, called MitoBurn, but it is a really cool effect. So when we exercise, this stuff, L-Beba, is released by PGC1A. So that's a protein that tells the rest of the body that the exercise has occurred, and it also gets the positive effects on the rest of the body from exercise. Like when we exercise, they talk about the brain benefits and all of that. Well, L-Beba is the one that will actually create that. And then fucoxanthine. And this one, it's funny because nobody was using this. And then we put it in the product, and now there's a bunch of people putting it in their products. I don't think they saw ours, but it was just like, oh, this is looking like a really positive outcome for people with lifestyle issues, obesity, diabetes, cancer, cardiovascular disease. I mean, there's been research in all of these areas and really has a minimal side effect. It's extracted from microalgae, actually. So it's really cool. It's actually a carotenoid. So it's similar to other carotenoids like beta carotene. And has many bioactive activities in the body. And then the last piece was grains of paradise. This is another one that's been getting a lot of popularity recently, and it wasn't even very well known a couple of years ago, but it's cool because it increases energy through activating brown fat, which the brown fat's the good stuff that creates metabolic burn. And we've been getting really good reports from the clients that have been on this. It's one of the more common ones that when somebody orders it, they'll order it again. That's always a good sign to me that we have a very effective product.
Wonderful. Yeah, I foresee a lot of our patients using this here in the future. Can we also talk about the BPC? This is one of my favorite products to use in the clinic because, as a chiropractor, I'm working with a lot of GI and tendon issues. And can you go over some of those benefits with BPC-157?
Yeah, actually, we're going to be having some articles that I'll share with you that I wrote on this just recently. But BPC, to help people understand what BPC is, BPC is body protective compound. It's a molecule that's secreted by the stomach. It's also a molecule that they identified that when you have a wound, it is drawn into the area around the wound. Now, BPC-157 is a small segment of that entire protein. So it's an amino acid segment that is taken from that natural protein that the body makes. And it's found to be the really active one in wound healing. When they first found it, they were looking at stomach ulcers, and they were looking at what's in the tissue around the ulcer when it's healing. And BPC was one of the big things. So they investigated it. What they found is that it induces blood vessel growth into damaged tissue. So it causes what they call angiogenesis. And when blood vessels grow into those tissues, it allows for more delivery of healing compounds from the body. Because a lot of times in wounds, these different healing components can't get into the area of damage, and this really helps it. But BPC works throughout the body on any injuries. There's studies that are using it on the brain, especially in using it to recover after TBIs. With COVID long haul, some people are using it with good results there. The big thing is soft tissue injuries. People that strain a muscle, have a tendon injury, tends to really accelerate the healing process for them that we've seen. And lastly, the most effective thing with taking it orally is the gut. I mean, I have never seen anything work like this in getting gut issues resolved. It just works every time. It continues to amaze me. I mean, we don't even use protocols of probiotics or prebiotics or anything to heal the gut. We just put people on a healthy diet, make sure they're not taking whatever it was that caused it in the first place. And then they can take the BPC. It allows the lining of the gut to heal by getting more blood vessel growth into it. So the body takes care of it naturally.
Yeah, I've seen very, very similar results with, we spend a lot of time working on GI issues in my clinic, and this has replaced, almost $1,000 worth of products that I used to use. So I definitely recommend this. I do stock it in my store at my clinic, but can you go over how they can get it if they're not, close to my clinic here?
Yeah. You can actually share your link with them on the below the video. where they can order it, and you get some affiliate credit for having sent them our way. But it's Piron.store. You can find it there, and we have a lot of other products, mostly focused on the anti-aging or healthy aging and age rejuvenation market.
Yeah. Well, Dr. Stickler, I appreciate, being on here with us to go over this. And as a personal note, I want to thank you for being my medical coach for the last 5 years. And I've made big improvement working with you directly. And, thank you again.
Well, I love seeing your progress. Keep it up.